if our hands are not too busy, let's welcome upstage the National Coordinator and Country Director of Rotary Action Group for Reproductive, Maternal, and Child Health in the person of Professor Emmanuel Adedolapo Lufadeju. Please let's put our hands together for him as he comes to take the mic.
Please keep clapping.
Please keep clapping till he takes the mic.
Thank you very much. I was very impressed by the addition of the old and new Nigerian anthem. That anthem came into being when I was in primary 6. So those of us who are fairly above 60 years old, we know that anthem offered. It's very impressive. Good morning, everybody. I'm very happy to welcome all of you. And this is an advocacy workshop, maternal and child health deaths in Nigeria, especially those deaths resulting from pregnancy and child complications. Distinguished guests, ladies and gentlemen, participants, and fellow advocates, I'm privileged to critical advocacy workshop on preventing maternal and child deaths resulting from pregnancy and childbirth complications in Nigeria. Today we gather with a shared purpose to demand action, mobilize change, and ensure that every mother and child has access to quality health care, dignity, and life. The stark reality is that approximately 58,000 women die annually from preventable pregnancy and childbirth-related complications. This is a staggering number, considering that nearly 20% of all global maternal deaths occur in Nigeria. Nearly 250,000 newborns die within their first months of life every year in our country. And countless families suffer the devastating consequences of maternal and child mortality in Nigeria. But we also know that 90% of maternal deaths are preventable with timely and quality care. Investing in maternal and child health yields significant economic and social returns. Collective advocacy can drive policy change, resource allocation, and improve service delivery. Ladies and gentlemen, over the next 3 days, we will examine the landscape of maternal and child health in Nigeria. We identify the gaps in policy, funding, and service delivery. We develop effective advocacy strategies to address these gaps and forge alliances and commitments among stakeholders. We shall also have the opportunity to enunciate the role, activities, and achievements of the Rotary Reproductive, Maternal, and Child Health in Nigeria in reducing maternal and child deaths in our country. Through expert presentations, panel discussions, and interactions, and all kinds of very productive sessions, we will amplify the voice of women, newborn, and our communities. We strengthen our collective resolve to end preventable deaths, chart a course for sustainable progress. We are grateful for the participation of the presidency through the office of the senior advisor to the president, Dr. Salma Anas Ibrahim, who is present with us here. Please, can you give her a round of applause? The Federal Ministry of Health, under the leadership of the Honorable Minister, Dr. Ali Pate, and TA Connect, who is our partner in this process, and all other stakeholders. Some of them have been introduced present here today. We are delighted to welcome government representatives from the federal, state, and local governments in the country, healthcare professionals, civil society organizations, community leaders, international and local development partners, and the academia. Your presence demonstrates a shared commitment to ending maternal and child mortality in Nigeria. Together, we can hold leaders accountable for policy implementation. We can increase funding for maternal and child health. We can improve access to quality care, and we can empower women and communities. Ladies and gentlemen, distinguished guests, let us leave this workshop with renewed determination of enhanced knowledge, strengthened partnership, and concrete action plans. Join me in this urgent call to action. Let us unite to prevent maternal and child deaths, ensuring every mother and child thrives. Thank you very much and very welcome.
Hello, thank you very much. Please give him another round of applause. Thank you, sir, for that. Thank you very, very much. Yes, it is renewed determination and enhanced action. That is what we will leave this place with. And I have the singular honor of welcoming our very own Dr. Anas, the Special Advisor to the President on Health, for her welcome remarks. Thank you so much, Ma, for all that you've done in championing women's health, child health, and the agenda of reducing maternal mortality in Nigeria. Thank you so much, Ma.
Thank you. I'm so sorry. I was a bit distracted. Yes, thank you. So thank you so much. Let me start by recognizing and appreciating my very good friend, the Country Director, National Action Group on RMNCH, Rotary Nigeria, who is also the National Coordinator of the program Together for Healthy Families in Nigeria, Professor Emmanuel Adedolapo Lufadejo, and his beautiful wife. Good morning to you. I also want to appreciate, welcome my very good friend, my brother, Mr. Yinka Babalola, the past Rotary Vice President, my sister, Madam Ijoma Okoro. Good to see you again. We last met in Cameroon, and I thought she's from Cameroon anyway. She's so beautiful and with her beautiful complexion. So you're welcome and good to see you in Nigeria. Now I know you are Nigerian Okoro, not Cameroonian Okoro. You are welcome. We have here representative of the Federal Ministries of Health. I've seen my sister, the Director, Health Promotion. I'm also made to understand we have representative of the National Primary Healthcare Development Agency here, and also other departments of the Federal Ministries of Health. We have state representative, a team led by the permanent secretaries of the state of the Ministries of Health. We have Ekiti, FCT, Gombe, and Nasarawa. I welcome you to Abuja. I also need to acknowledge our great development partners that have always been with us in this quest to ensure women are healthy and children. We have WHO, Dr. Martins is there. The country representative of UNFPA and his team are also with us here. I ought to acknowledge also the country director of TA Connect, and I acknowledge all Rotarians that are here. I don't want to make a mistake with your nomenclatures because it's very vast, but I acknowledge all of you, the governors, the district governors, and whoever. And by the way, I am also a Rotarian, though not very active. So I welcome all of us, distinguished ladies and gentlemen that are here, including our media, and fellow advocates, because we are all advocates in this room. I'm profoundly pleased to be with you at this very important advocacy workshop. Sorry, my sister from NCWS, I welcome you. She's also representing the National Women's Society, which is very key, and they play very important advocacy when it comes to issues of women's health. So we believe that this workshop will support ongoing efforts of the federal government of Nigeria because it fully aligns with His Excellency President Bola Ahmed Tinubu's vision for Nigeria, that all Nigerians women should be healthy and no woman should die as a result of pregnancy or childbirth-related causes. And our children should be healthy because they are our future. So this fully fits in and aligns with his agenda of attainment of universal healthcare coverage. Distinguished ladies and gentlemen, as you know, since Nigeria had its independence, we have always prioritized the health of women and children as its pathway towards achieving the ethos of health for all Nigerians. However, you will agree with me, and Professor Lufadijo has mentioned also in his welcome remarks, we are not where we want to be, and our progress has been very slow and very, very sluggish. Maternal and child health outcomes in Nigeria remain very poor, as we have seen evident by the most recent National Demographic Health Survey of 2024. We've not made progress, so let us not deceive ourselves so that we really set up and get ready to do the job, to reduce maternal death, to improve maternal health, to reduce child illnesses, reduce childhood mortality in Nigeria. So this just came out, the survey, which we have been using. The progress is very little. For maternal health outcome, although the estimate for maternal death from the NDHS, we are still waiting for it. We are still discussing. I don't know why it was not presented, but we have seen other statistics. I think it is still being calculated. But we can glean insights from other determinants of maternal health outcomes. According to the NDHS of 2024, we saw that ANC, antenatal clinic, attendees by women, pregnant women, still stands at 52%. And we want to be at 95% by 2030. So we are still far away from it. We have also seen that the number of visits, 63% of pregnant women receive ANC from skilled birth attendant. In this survey that we saw, a coverage that is slightly less than that of 2018, which is 5 years ago. We understand that a lot has happened, but I'm not giving excuses. Within the last 5 years, we had the COVID pandemic. The insecurity also worsened in the country, but those are not excuses that are not surmountable. They are all surmountable, and I believe we can do better. So at that time, it was 67% And it became lower than 57% to about 63%. I'm sure most of you will say we are not surprised because of several reasons that I have mentioned few. When the time for a pregnant woman to deliver her baby comes, ensuring that delivery is taken by a skilled provider optimizes the chances of successful delivery, care at the point of delivery, because that is the peak. That is the point where most women lose their lives, at the point of delivery. If you can have a perfect antenatal care clinic, which is very important, but if you don't come back or you are not delivered by a skilled birth attendant and anything happens, and things are likely to go wrong in most cases at that point. And that's why all the help, the support are needed at that critical moment. And this is grossly lacking in Nigeria. However, despite marginal improvements on 43% of women who deliver at health facilities, only 46% are delivered by the skilled birth attendant. Postnatal care, coming back to facility to be seen by a health worker, also improves survival of mother and children within 48 hours after delivery. Is of great value to a mother and to her child. A significant proportion of maternal and newborn death occur within this critical moment, that is within 48 hours after delivery. And that is why the postnatal care is still very significant. Unfortunately, what we saw today from our NDHS of 24, only 43% of women come back for postnatal care or have access to postnatal care. So this is grossly inadequate, because this is where you initiate, you continue immunization activities, you educate them, you do the health talk, and then you improve uptake of immunization. And also, most importantly, you also provide information on family planning, because this is where the women immediately after delivery, they are ready. As a woman, after going through pregnancy at that 48 hours, you don't want to go through it immediately again. So that is the best time to catch women and talk to them about family planning. And we know the importance of family planning. It automatically reduces maternal death by almost 30% or more. So that would have been a great achievement in the life cycle of every woman before another pregnancy, to have access to quality family planning services immediately, especially within that postnatal period. So having said that, distinguished ladies and gentlemen, for child immunization, it remains one of the most impactful vaccinations in saving lives and enabling them to attain their full potential. And I want to sincerely appreciate the efforts of Rotary Nigeria for helping us, for being our friends, for being great partners in immunization, under 5 immunization. I must single out my very good brother, Mr. Yinka Babalola, who just came from my state, Borno State. He did not even he wasn't just in Maiduguri when he called me. He said he was in Kwayakusa. This is a local government, a small village in the southern part of Borno. You know, with all the stories we hear about the insecurity, that has not deterred him from going to those areas. Dr. Babalola, I want to sincerely appreciate you. And I'm saying here from the bottom of my heart, if all Nigerians have that level of commitment and interest and determination that we can do it, and we are still doing it, a lot will change in this country. So it's not about the government alone, but it's about ourselves, our own determination to get things done. And I sincerely appreciate you, my friend, Dr. Babalola, for still, we've been doing that with you when I was Commissioner of Health in Borno several years ago. And I couldn't believe when he still told me that he is in Kwayakusa, you know, delivering and supervising polio vaccines. Thank you so much. Distinguished ladies and gentlemen, the key thing to observe in this RMNCH outcome is that we are recording some little progress, which is, however, a rate, as I said, too slow to push us towards attainment of RMNCH targets as we committed to the Sustainable Development Goals and other global commitments. So something has to be done immediately and differently. And this workshop is bringing more people on board as advocates. And I think this is a laudable initiative. And it's great, actually, Professor Lufadejo, for thinking through this and then partnering with our office to see that we advocate. And that is essentially what we do in my office, to advocate, to convince people to do it. And I've always said we have to have our own homegrown solutions to address the issues. And we have embarked on several advocacy activities in the last 1.5 years, especially to states with high burden maternal death, and also high poor survival of children across the country. And states that were initially doing well in the past, but then they begin to derail. So we were in Ondo State, and we saw that they were one of the best in the country before from the previous NDHS. Then they started derailing. So we were there. We did a lot of advocacy. And I'm glad to mention that His Excellency, the Governor, Aida Tewa of Ondo State, has taken immediate action after our advocacy. And he has put back Ondo State on the right track to success. So I must appreciate him here. We're also in Abia State. We met with His Excellency, the Governor, who has also committed and has also nominated his wife to champion maternal, newborn, and child health in Ondo State. Some of our visits were to the northern states, in Sokoto State, which has one of the highest burden of maternal death and child survival. And also we're in Borno State. And similarly, the two governors also expressed the same. So you can see the power of advocacy in making things to happen. We must begin to break barriers and speak with those that are at the helm of affairs to achieve the desirable changes within the shortest possible time. And I said, this is possible. We can change in 9 months to 12 months. The life cycle of the pregnancy is 9 months. So if we decide to say today, every woman that is going to be pregnant this month, we target her, we will see changes in the next 9 months. It's doable. And I believe with advocacy, we can do it. Building on the modest achievement from the efforts of the previous administration, I'm glad to mention that the administration of His Excellency President Bola Ahmed Tinubu is committed to fast-track improvements in the health outcomes of Nigerians, especially those of mothers and children, because they are those that he tagged under the vulnerable group. And we have witnessed a lot of transformations happening in Nigeria through the Vulnerable Group Fund, which is managed by NHIA, the continuation also of the Basic Healthcare Fund to ensure that our primary healthcare facilities are strengthened. Our primary healthcare facilities are well equipped, not only with medical equipment, supplies, and commodities, but also with the right sets of human resources to deliver quality healthcare services. So a lot is happening in the country, but even with as much as it is happening, with the resources that we have in the country, we must advocate. We must be on the same page. You know, it's not about us healthcare providers having the services available, but it's also about the individuals, about the families, having the mindset to trust and have confidence in the services that we are providing, in them accessing the services. So we need to continue to advocate to our key stakeholders, our policy makers, including those at the National Assembly, at the State Assembly, religious leaders, community leaders, so that we are not just talking to ourselves, but also talking to the right people that are expected to access and uptake the available services within our primary healthcare facilities and also within communities. So I want to really appreciate and say that this is coming at the right time, and we will continue to ensure that we strengthen that partnership between us and the Rotary International and all our development partners and civil society organizations that are here. We've done so much with a lot of them. For instance, Dr. Amina Magashi's NGO, Civil Society on the Africa Health Budget is also very significant. Through advocacy, we're able to have, it's not where we want to be, but we've had a slight increment in the health budget at the national level. But what we want to see more happening, especially at the subnational level, the states that are here, is more advocacy to your state governors, more advocacies to your relevant political appointees and elected more advocacies to the State House of Assembly so that you will have more allocation to health when you have their overall budget. So apart from allocation, it's also ensuring that you follow through to ensure that the funds allocated are timely released and are also fully utilized for maternal, newborn, and child health within the health sector allocation. So sometimes you see a big health sector allocation, maybe 16%, but when it comes at the end of the year, not up to 5% of it was released. And even the 5% release, in some cases, or most cases, I would say, you will realize that it's dedicated to infrastructure, buildings, and several other things. So you need to ensure that you capture allocation for maternal, newborn, and child health within the health sector. What percentage does it contribute? Including procurement of family planning commodities. It is very important, and you follow through on that. And I'm glad to mention that most states have committed also to create a Department of Family Health in their respective states. That is a huge structure that must be established. I can mention Ondo State, Lagos State, Jigawa State, Gombe State. Gombe is here. Clap for Gombe State. Gombe have created a department, if it is a division of family health, it's a step forward. And that is the beginning of institutionalization of budgetary allocation for family issues. If you don't have that, it's very difficult to have a budgetary allocation because it is that DEX office, it is that office that developed the plans and defend it at the state assembly. So we also encourage all other states, and part of the advocacy that we will want Rotary to help us do with all our development partners, UNFPA is here, WHO is here, is also engaging with the commissioners of health and the high-level policy makers to ensure that as part of the work of the state ministries of health, they also have a primary health care department, just like they have a department of public health. And that sets them and positions them well for action to reduce maternal, newborn, and child health, and also accelerate reduction of maternal death. So I'm not here to say so much, but to appreciate all of you, especially Rotary RMNCH for their vision in conceptualizing this workshop. I also want to appreciate sincerely all of you, our development partners, all of you that came from the state for making your time to be here and for working with us to ensure that no woman or child is left behind. And I strongly believe that together we can do it, together we can succeed. Thank you so much. Thank you. All right.
Thank you so much, Ma, for that very insightful keynote address. So she did her opening along with a keynote address looking at an overview of maternal and child health situation in the country. And of course, you know about the special advisor to the president, Dr. Salma Anas Ibrahim, that she's someone that walks the walk and talks the talk. Thank you so much for the insightful presentation, talking about child immunization, how critical it is, family planning, and of course, the states that have already started instituting departments of family health. We're sure that since some states have started, other states will take a cue from it. Please, I think she deserves another round of applause for that. Thank you very much. Just before we take the rest of the welcomes, I'll just do a quick recognition. We have from Ekiti State a whole team, but being led by the Permanent Secretary of the Ekiti State Ministry of Health, in the person of Mrs. Olushola Gbenga Ikotun. You're welcome, ma'am. And she's here with the Director of Primary Health. She's here with the Reproductive Health Coordinator. You're welcome, as well as the Family Planning Coordinator. Please let's appreciate them all from Ekiti State. We equally have a team from Gombe State, and of course, she's wearing two caps now, representing the Honorable Commissioner of Health, as well as the Executive Secretary of the Primary Healthcare Development Agency in Gombe State. Please let's welcome Dr. Miriam Abubakar and her team from Gombe State. Please let's appreciate her. And then from Nasarawa State, we have the Permanent Secretary, who also led a team here of the Reproductive Health Coordinator as well as the Family Planning Coordinator. Please let's appreciate Dr. Damina John Ali, as well as the team from Nasarawa State, Mrs. Salome Vincent and Mrs. Esther Yona. Please let's appreciate them. I think they're seated somewhere behind. Thank you very, very much. And then from the FCT, also representing the Primary Health Care Board, which we work closely with, we have the Reproductive Health Coordinator and the Family Planning Coordinator, ably representing the board here in the person of Mrs. Eniola Awoniyi and Mrs. Memuna Mikhail. Please just appreciate them. Without much further ado, we'll quickly finish up with the welcome from the planners of this. So we still have the National Primary Healthcare Development Agency as well as TA Connect. So I'll take it in that order. They'll be giving us a welcome remark in about 3 minutes each. We have representing the Executive Director of the National Primary Healthcare Development Agency in the person of Dr. Mohammed Bello. Please let's welcome him as he takes the podium for his opening remark. Please let's keep clapping till he takes the mic.
The Special Advisor to the President on Health, morning, ma. Representative of the Federal Ministry of Health and Social Welfare, representative of states, various states in attendance, partners, leadership, and members of Rotary International, especially Rotary MNCH. I bring you greetings from our Executive Director, CEO, Dr. Mui Aina, who delegated that I must leave all what I'm doing to be part of this conversation because of its importance. And to stress just 3 points. Realizing the challenges vividly and elucidly put by the Special Advisor on our poor performance in the health indices, especially on maternal and child health. We recognize as an agency the central role of primary health care level of the health sector. And as a mandate that we have to translate the policies and priorities of the federal government, the agency has realized the need to reposition our parastatal, the agency to interpret into vivid and practical activities to translate the presidential renewed hope agenda for health, especially with the coordinating minister's priority that he has identified to changing the narrative. At the agency, we recognize 3 key factors that will lead to success in all these areas identified. We have the demand side, we have the supply side, and then the governance. At the agency, we recognize the need to set priorities to translate into action the component of the Honorable Coordinating Minister Health Sector Renewal Investment Initiative into priorities we identified that are critical to attainment of our mandate as a country. Nigeria is signatory to various commitments and regulations internationally and nationally that aim to fast-track attainment of universal health coverage. We cannot do that without a very functional PHC. Therefore, the agency is driving on efforts at revitalizing PHCs across all the political worlds in the country. This is centered around infrastructure, human resource for health, equipment, and then on the health and work ethics in the PHC, so that we have a very robust system that will meet up to the demand of our teeming population. We also have as a priority scaling up innovations that will improve utilization and quality of care for the RAMCAN services. And we have 3-4 key things that we intend to do, and we have started doing in collaboration with our partners at national and sub-national level. One is to optimize ongoing RAMCAN services to make sure that populations get it at when due. And then we are at the effort of identifying various evidence-based innovations that will fast-track the progress towards improving maternal and child health, including PPH bundle and all these things that will improve our health indices. Another issue is that of quality of care. We want to improve the access so that people will go to the facilities, but then what do they meet there? Do they get what is expected based on current evidence and a way that is very respectable to them? So we are, together with Basic Healthcare Provision Fund, NHIA, and other parastatals of the Federal Ministry, scaling up activities that will improve quality of care at the PHC level. And we do that through making performance-based disbursements to these facilities using our basic healthcare provision fund and ensuring that these protocols are adhered to at all the facilities. We also have community component of MPDSR that will strengthen the community to identify gaps that hinder pregnant women and children from accessing very critical services that will save their life and prolong their life and improve productivity. Community MPDSR is being implemented in more than 22 states, and we intend to scale it up. And on this note, let me congratulate the country because of the various support we are getting from Rotary. Prof, we've been together with him trying to drive this community MPDSR. The reasons why women die is not rocket science. We all know them. Theoretically, everybody knows why the women die. But then we have underlying factors at the community, at household level and facility in the PSC that aggravate these problems. So the issue is to tackle these problems, empower the community to recognize the danger signs, and try to identify factors that will prevent them from accessing these services and overcome them. And this is what we set to achieve at MPDSR. Child health, the major component of it is about preventing diseases that are caused by agents that can be prevented by immunization. We have gained a lot of experience and we have a lot of resources for the polio campaign. We want to streamline and integrate the polio SIA and non-polio SIAs to maximize the quality and reach so that we integrate all this vertical intervention into the system and then to reorganize the campaigns and strategy to redesign all what will happen. Lastly, is about the human resource at the PSC level. We've been implementing a community-based healthcare worker program that has been on for more than 4 years in various states of the country. Looking at the need to reorganize this program, we are redesigning it to give it a new look, to optimize what we do, and then ensure that we create the demand from the household level so that children and mother will stop to suffer from what is preventable at that. So we are reorganizing and redesigning with most of the stakeholders. We are upskilling more than 120,000 frontline healthcare workers to be able to provide optimal services. And we are doing that with support with our various partners. Looking at all these intervention and innovations, one key message that we have from the PSC is to ensure that the sector-wide approach is implemented to the fullest, whereby everybody's effort and resources is brought to the table to avoid any wastages and duplications so that together we move the country forward. And we appreciate this, and our message is that all the partners are welcome to come on the table to make sure that we do things differently to fast-track our progress toward attaining universal coverage. On this note, I will also appreciate once more Rotary International for their support, and we want to continue on this path, and thank you. God bless. Okay.
Thank you very much for that. Please, can you give him a round of applause? MPHCDA is at the center of reducing maternal and child health, improving quality of service, addressing human resource for health, and also helping us deal with many underlying issues. I have the singular honor of inviting Dr. Lillian Anomachi, the Executive Director of TA Connect, to give us her welcome remarks. Please clap for her. These are the organizations that put this together, thought it through, and felt that it's important for us to learn and unlearn and build up that determination for advocacy. Thank you very much, Ma. You're welcome.
Thank you very much, and good morning, everyone, esteemed guests, colleagues, advocates. Please allow me to stand on the protocols already established by the senior advisor and the MPHCDA. It is both an honor and a privilege to stand before you today at this National Advocacy Workshop, where we have come together with a shared mission, which is to significantly reduce preventable maternal and neonatal deaths in Nigeria. The theme of our gathering, which is working together to reduce deaths of mothers and newborns in Nigeria, serves as a powerful reminder that collaboration is the cornerstone of impactful health initiatives. The wise people say, if you want to go fast, you go alone. But if you want to go far, then you need to collaborate with others. At TA Connect, we recognize the urgent need to address the maternal and neonatal rates in our country. Every day, we lose mothers and newborns to complications that can be prevented by effective and qualitative healthcare systems and services and dedicated community engagement. It is our collective responsibility to ensure that every woman receives the care she deserves, every newborn is welcomed into a safe environment, and that families are supported through this period of pregnancy, labor and delivery, and even into the postnatal period. Advocacy plays a crucial role in this process. It is through advocacy that we raise awareness, mobilize resources, and influence policies that directly affect maternal and neonatal health outcomes. By amplifying the voices of the vulnerable and fostering dialogue among stakeholders, we can illuminate the path towards meaningful change in our country. Advocacy enables us to hold ourselves and our government accountable for the commitments we make, ensuring that maternal and neonatal health remains at the forefront of our national agenda. Today, as we gather here, we are not just representatives of our organizations, we are advocates and champions for the vulnerable and agents of change in our communities. Our partnerships across sectors, be it government, non-profit, civil society, and the private sector, are vital in creating a comprehensive and sustainable framework to improve health outcomes. TA Connect remains committed to strengthening healthcare systems and enhancing access to essential services, especially for our mothers and children. We're already partnering with the National Primary Healthcare Development Agency and the Federal Ministry of Health to ensure that some of the maternal and neonatal innovations that the country has adopted are institutionalized and scaled and taken to scale across the country. So while we remain committed, we believe that empowering healthcare providers, improving data-driven decision-making, and fostering community involvement are all crucial strategies that will drive positive change in a sustainable manner. As we engage in discussions, share ideas, and develop actionable plans today, let us remember that our work is just not about statistics or data. It is about lives. Lives of mothers, lives of infants, lives of the families that will be affected if anything happens to them. We must leverage our strengths and unite our efforts to implement effective interventions that resonate with the communities that we serve. It cannot always be a top-down approach. In closing, I urge every one of us to take this opportunity to collaborate, innovate, advocate tirelessly for our shared goal. I believe that in doing so, we can create a Nigeria where every mother, infant, and child not only survives, but thrives. Thank you for letting us at TA Connect join hands with you to make this vision a reality. Thank you.
Thank you very much. Please, can you keep clapping till she gets to her seat? Okay, so we started the day with the statistics, the glaring statistics of the situation, and Professor Lufadeju helped us, actually paint that picture. But he told us one thing that was important, that we are here to amplify the voices of women and children in Nigeria. And we're here really to have a renewed determination and enhance action to ensure that wherever we're working, things change. The special advisor then went on to tell us what NDHS today is saying, and the little progress that has been made in many areas, and a few areas where we have lost stand. Yes, but she said something that was very crucial. We are not here to make excuses. Whatever the situation, it is something that we will have to deal with. She brought us good tidings from the president, President Ahmed Tinubu, and the agenda on health, which she has been pushing, showcasing the fact that the advocacies that have been done in the last few months have begun to yield fruit, and we got excited. She also shared with us the power of advocacy to break barriers, and that's why we are here. And that's why the ministry, MPA, CDA, and everyone that is here, and also the Office of the Special Advisor and the Rotary Together project, it's here to actually build skills, improve knowledge, and then re-energize us to change. The MPA-CDA came to tell us clearly what they are doing with both primary healthcare work and the essence of advocacy in all that they are doing. TA Connect, in their own work, helped us to understand that collaboration is a cornerstone for wider impact. And that's why all the members here, Rotary, and everyone who is here, collaboration is what we seek. And she called us to a very, very deep action, that our work is about lives. Our work is about the lives of women, about the lives of children, about the lives of families. And some of them are our families. Yes, the lives of families. And so when we are here, we should make friends, leverage opportunities, and connect so that we can change the trajectory. Thank you very much. That was beautiful. Please, can you clap for them again? While we proceed very quickly with the goodwill messages, the goodwill messages will be 1 minute each. We have a beautiful list here, and we will try to pull that quickly so that we can get into the meat of today. So I would like to call my co-host to take some of the list. Thank you very much.
So we'll start with the Federal Capital Territory. We'll start with the FCT Primary Healthcare Board. Can we have a representative of the FCT Primary Healthcare Board to come and give us a goodwill message? All right, if they're not ready, then we'll skip to the next. We'll come back. Are we ready? We'll come back to the FCT then. All right, so we'll go to the states. Please, let's welcome the representative of the Commissioner and the Executive Secretary from Gombe State, Dr. Miriam, for a goodwill message. Please, let's appreciate her as she comes. 1 minute each, please. After Gombe State, Nasarawa, please get ready. And after Nasarawa, Ekiti State, please get ready. Then we'll come back, we'll circle back to FCT. 1 minute each. Thank you very much, ma'am.
Good morning, everyone. The SA to the Presidency on Health, the Country Director, Rotary. Please permit me to stand on the existing protocol. It's my humble privilege to stand here before you on behalf of the Honorable Commissioner, State Ministry of Health, Dr. Abud Ahiru, Damasanin Deba, and the Executive Secretary, Gombe State Primary Healthcare Development Agency, Dr. Abdul Rahman Shaibu, who are on an official assignment outside the country. They bring their greetings to you, and they want me to extend their regards. For us in Gombe State, we want to felicitate with all the stakeholders that are here present, who are gathered to address the issues with regards to maternal and child health in the country. I want to commend our unwavering commitment to improving healthcare outcomes across the country. It is also our honor and privilege to be here with regards to promoting equity and equality with regards to assessing quality healthcare and ensuring the well-being of vulnerable populations, particularly pregnant women and children in the country. Our government remains committed to supporting the policy and programs that prioritize women and children well-being across the state. We recognize the critical role advocacy plays in shaping healthcare policy, and your voices are crucial in informing our decisions and driving meaningful changes. In conclusion, I want to state that may this workshop foster meaningful dialogue, innovative solutions, and strategic partnership to strengthen Nigerian healthcare system, and wish all of us successful and impactful engagement. Thank you.
Thank you very much, ma'am. I believe the protocol that the special advisor to Mr. President of Health already set up is very heavy enough to take every one of us. So I would like to crave the indulgence of everyone coming to give a goodwill message. Let's just do it within a minute. I think we can just stand on that already existing protocol. So for Nasarawa State, I have the honor and privilege to call up the Reproductive Health and Family Planning Coordinator, Mrs. Salome Vincent. Please appreciate her.
Good morning, everyone. Permit me to align with the already established protocol. I am here with my bosses. I don't know why I was nominated to come and give the goodwill message. I want to appreciate my boss for giving me that privilege. I want to also especially appreciate Rotary International for the good work you've been doing for the state and other partners. I think it's a good thing to collaborate with people and also give them a good working environment. As we can see from our the last NDHS, we have been able to move family planning from 14.3 to 22.2%. It is with the help of all the partners seated here. So we want to appreciate all of you, and then we want to assure you that our doors are always open to accommodate partners and also collaborate to move the needle forward. So thank you very much, and I wish us a successful deliberation.
Thank you very much, ma'am. Let's have Ekiti State for the goodwill message. And after Ekiti State, we'll circle back to FCT. I'm sure a nominee must have been appointed at that time. Please just appreciate the permanent secretary from Ekiti State.
Good morning, everybody. And as the host said, please permit me to stand on the existing protocol that had been established. I bring you greetings from the state governor, and the Honorable Commissioner for Health and Human Services, Dr. Yebanji Filani. I want to really appreciate the good work that Rotary International is doing, especially in Ekiti State. No matter what, the lives of our women and children are precious. And at this age, it is still something that is heart-rending that we still lose women at delivery stage. And what Rotary International has done has actually helped the state to know that we can do it if we do what is right part time. Thank you so much for adding 2 facilities to each of the local governments that you are helping us with. We really appreciate you. We appreciate the trainings and the support given on consumables. And on this note, I want to wish all of us good deliberation as we move the nation forward and help restore health of our women and children. Thank you.
Thank you very much, ma'am. The reward for good work is more work. FCT, please. Please, a round of applause for FCT representative to take the goodwill message. And after FCT, I know we'll skip the National Health Insurance Authority. I don't think there's a representative from that organization here yet. Then we'll go to the partners here, WHO, UNFP, and that order.
Good morning. I'm Dr. Tabunde from FCT. We want to thank everybody for visiting FCT. We are your hosts. Standing on existing protocol, we want to say that today is a good day for most of us. Most of us are women, and when we talk of advocacy for reproductive, maternal health of child, it concerns us women. Though our husbands are involved, but it concerns us women. A lot of our friends, we've lost them in very, very simple situations that shouldn't have happened. I want to thank the Special Assistant to the President on Health for moving on advocacy workshop. Yes, in FCT, you think we don't have problem because we are in the Federal Capital Territory. But a lot of our sisters, our mothers, are in the periphery, not in Uye, not in Metama, not in Asokoro, but there are places called Robochi, there are places called Nyanya, there are places called Karishi, there are places called Abaji. I'm sure some of you are hearing these names. We have our sisters there. And I want to thank the Special Assistant and especially Rotary for partnering with this advocacy workshop. We know that at the end of this program, we in FCT will also be encouraged to move further into the hinterland. Our primary healthcare have done so much work. But when I looked at statistics that was put up for Nigeria, and saying that about 52% of women actually come in for antenatal, and only about 42 return. I started wondering if it is true, because here in FCT, we just assume all pregnant women come to hospital. And Ma, you have challenged me this morning, and I think in the next maybe 1 year you'll hear from me. I would like to look into what happens to our mothers that have come into FCT in the past 1 year. Rotary, thank you very much for helping us in a lot of time, especially for Caro General Hospital. You did a lot for us in our pediatric unit there. I will always be grateful for Rotary for helping health. And at the end of this program, I look forward to seeing more improvement now in FCT and reviewing how much we've done and if our work on reproductive health had declined, because there was a time we're running free antenatal and we achieved a lot. Thank you very much, Ma, for the program, and thank you, Rotary, for partnering with this program. Thank you.
Thank you very much. We will come back to the Rotary Foundation. I want to get clarity on the person who is going to do that. In the meantime, let's go to WHO, please. The World Health Organization. Please, let's appreciate him.
Yeah, good morning, and please permit me to stand on the established protocols on behalf of our head of mission, Dr. Walter Kazadi Mulombo, who is engaged in another equally important activity and has allowed me to come here and represent him. We really wish to appreciate the organizers of this event, TA Connect and the Rotary International, for this very commendable and timely discussion. We've had the very grim figures from even our latest demographic health survey. Globally, if we look at the SDG, only about 20% of countries are on line of meeting the maternal and child mortality. And one of the things we can do about this is actually that amplifying of the voice of the woman, the voice of the child, ensuring that communities and families and individuals are empowered. So this is a very timely conversation, and we just look forward to very fruitful deliberations and indeed to work together in making whatever plans and actions that will come out of this conversation implemented and bear fruits. We want to see that voice of the woman, voice of the child amplified. We want to see the those indicators here in Nigeria and globally improving. Thank you so much.
Thank you very much, sir. Just before I call UNFP and other partners, I told you we're going to come back to the Rotary Foundation. Please let's welcome Trustee Ijoma Pearl Okoro for the goodwill message on behalf of Rotary Foundation.
Good morning, and thank you everyone for being here this morning. Let me recognize my sister again, Dr. Salma. Even in the good book, we are reminded that you can take a project, a goodwill, goodness to an environment, and they reject it. So first, I want to thank the Federal Republic of Nigeria for making it possible for Rotary to do what it knows how to do best. And that is ensuring that health is key at all times. I want to thank you, my sister, for representing the presidency well. All our supporters that are here, there's no need starting all over again to mention you one by one. Thank you for collaborating with Rotary. Thank you for partnering with us. And for the Rotarians here, being represented in full by our district governors, our bosses, I want to thank you. I know this is a very busy time for you, but you consider this important and you left it to be here. I want to thank you. Rotary is actually doing a good work, and I am pleased and satisfied. There's nobody that has spoken here without saying thank you to Rotary, and that is the reason why I came. I came all the way from Port Harcourt just to make sure that people are thanking Rotary, and I'm already satisfied. Thank you so much. We are poised to ensure that goodwill will continue in the work. That's all we do. That's what we do best in Rotary through the Rotary Foundation. I'm also happy that the three focal points that represent the main things we do in Rotary, that is polio through the Nigerian National Polio Plus Committee, the Rotary Community Health, Rotary Health Community Challenge, and of course the Together for Health, Together for the Project for Healthy Families, Professor Lufadeju, Dr. Balogun, and PDG Joshua Hassan. It's so comforting and reassuring to see you people here. And you can also see that our partners and our collaborators are thanking us. We won't get tired of doing good. We'll never get tired. And we are confident that with all of you, we'll definitely get to where we are going, especially with this our craze to ensure we achieve a polio-free world. I'm also happy that in all that you're doing, you're also partnering with us to ensure that we keep our promise to the children of the world, a polio-free world. Thank you, and enjoy your days today. Thank you.
Thank you very much, ma'am. I'll go to UNFPA. And after UNFPA, we'll have TA Connect for the goodwill message. Please, let's put our hands together for the representative of UNFPA.
Good morning, everyone. I bring you the very warm greetings from UNFPA, the United Nations organization, with the mandate of delivering a world where every pregnancy is wanted, every childbirth is safe, and every young person is able to fulfill its potential. And I will be standing on the established protocol, but allow me to especially recognize Dr. Salma, present here, who is also a member of a UNFPA family. So I am really happy to be here today to participate in this advocacy workshop that is organized by the Rotary in partnership with the Office of the Special Advisor to the President on Health. The fact that this workshop is led by the Special Advisor and with the presence of the diversity of stakeholders here present in this room demonstrates the common realization by all of us that it is the importance of advocacy for the work that we are doing to reduce maternal mortality and child mortality in Nigeria. Just like Dr. Salma and Professor Dolapo already mentioned, despite our collective efforts, NDHS after NDHS, the maternal and child mortality indicators are not at the level where we want them to be. So we need, therefore, to do something differently. So I'm so very happy that we are gathering for those 3 days here to discuss how we will do advocacy better, identify how we do things differently to change the way we are doing things and we see things so that our expectations will be met. So my really expectation for this workshop is that we will be able to partner and work together and coordinate our efforts so that we will achieve the expected result for the women and children of Nigeria. So I want on this note to wish all of us a very productive workshop. Thank you.
Thank you very much, UNFPA. I would skip a couple of organizations there because I understand that their representatives are not here. Bill and Melinda Gates Foundation, JPIGO, CHAI, SFH, PPFN. At least I've looked at the list outside and I understand that they're not yet here. So I'll go to the Society of Obstetrics and Gynecology of Nigeria. That is SOGON. Please, a round of applause for the representative. Please, let's keep clapping till he takes the mic.
Good morning, everybody. I want to stand on the existing protocol. Please, can we stand for 1 minute silence in honor of the President of Society of Obstetrician and Gynecology that passed on earlier on this year, please. A minute silence. May his soul rest in peace. I want to use this opportunity to thank the Rotary Club International for us as the Society of Obstetrician and Gynecology, for helping us to amplify our voices on the issue of maternal and child health. And we want to also thank Rotary Club for helping us in the fight to reduce the issue of maternal and child health. I want to say here today that at the end of the deliberations here today, whatever the outcome by the Rotary Club International, I want to ensure that we as Society of Obstetrician and Gynecology, we wish to collaborate and also assist Rotary Club International to actualize whatever deliberation is achieved here today. Thank you.
Thank you very much, Sogon. I'll yield the mic to my boss. He wants to specially acknowledge certain persons, and then we'll come through to finish the goodwill messages. So it is still in the order of goodwill messages. Please, let's appreciate Professor Emmanuel Adedolapo Lufadeju, Country Director, Rotary RMCH. Please, a round of applause for him till he takes the mic.
When I looked in the list, it's now coming to the hierarchy of Rotary. So let me quickly call on Pastoral Vice President Yinka Babalola to make a 1 minute comment. Welcome. And then I will ask my governors who are present here to nominate one of them, if it is possible, to represent everybody, or if everybody wants to do one by one. We don't mind. 1 minute is quite okay.
Thank you, Prof. Good morning, everybody. You know, one of the things Rotary do to you is that at some point your classification is missed. Who will believe that a professor of agriculture is leading effort to make sure no woman dies at childbirth? Prof, am I correct that you are not a professor of gynecology? That is what Rotary does. And for those of you who had Dr. Salma call me Dr. Yinka, if I hear you call me Mr. or Engineer again from today, I will quarrel with you. Prof, I've always supported your project just because it is Rotary. But I think you have a new advocate for whatever you are doing in a different way today, and it's an advocacy workshop. I was in Gombe, just like the special advisor, senior special advisor the president mentioned, and Borono. And when I got to Gombe, I knew we had a project. Rotary has a project in Gombe. So I called PAG on those. I said, I want to see that project. It was at no notice. And then I went to the place. A health center only the London part of it I remember. London, remind me. London, Bedurowa, you see, I always remember the London part. And for my fellow Rotarians, let me tell you what I found interesting. I went there unannounced, and I talked to people, and thank you, Ruth, for organizing. Two things happened to me. I'm telling this story so that when we ask you to bring money, you don't complain. First was, there was the imam, there was the Meyangoa, is it? Yes. That's the community head, as it were. And the World Development Chair or somebody like that present. I schooled in Bauchi, so I understand some Hausa, you know. The only one I won't forget is Inasonki. Any other one, I have forgotten. Okay, so you people are awake. Okay, that's good. Now, they were talking. And they were all saying, these are the Rotary people. These are the Rotary people. These are the Rotary people. And then there were prayers. And you can see there were prayers from the bottom of their heart. Telling, God bless you. God bless you. I received the prayer on behalf of all of you. And I'm sure as they were saying, God bless you, you are all getting it. All those that are supporting the work that the Rotary Foundation does. That is one part. Let me tell you the part many of you may not have known. The chief nursing or officer in charge of that health center said, Rotary started helping us about 16, 17 months ago. And you see, because of Rotary's help, in the last 1 year, no mother has died in this hospital. You know I'm not from Gombe. The nurse said, in this hospital, where they take deliveries, said in the last 1 year, because of Rotary's help, your help, no mother has died from childbirth. If you don't get inspired, I wonder what else will inspire you. Advocacy is important. I went with Ruth, the state midwife for the project, to a radio station. And somebody called in talking about it's only wives of poor people that die at childbirth. And that is not true. That is not true. Just in the last 1 year, we've lost 2 Rotarians, I think a Rotarian and a Rotaractor, who died at childbirth. And they were not, you won't classify them as poor. So we have work to do, like Dr. Salma said. It's just that we don't have enough hands to do it. So you know where I'm going next. If you are in this room and you are not a Rotarian, even if it's semi-active like Dr. Salma, it is time to join. So it can help us. The purpose of this project is to do a pilot that we can then scale up. How do we scale up if we don't have the people? So I want to say thank you very much and congratulations, Prof, to what this project is achieving. And like our trustee, Hijama, said, that's the Nigerian Okoro, like she said. I'm also glad that we have the Nigerian National Polio Plus Committee represented for immunization, and that we have the Rotary Community Health Challenge program director here also. Because for those three groups, we are trying to achieve one thing, that every pregnancy is wanted, every woman that gets pregnant carries it to term and delivers it successfully, and every child born survives. Thank you very much for all you are doing.
Thank you very much. DG Olowolagba, please, to represent all our 6 district governors.
Thank you. I seek your indulgence to stand on the existing protocol. I thank our PDG Lawrence, PDG Lufadeju, for inviting us to this program. My admonition on behalf of our chairman to our PDG is that we have veritable tools in Rotary clubs and Rotarians in the country that can be used and properly harnessed to carry out advocacy in our community. As such, I am imploring the action group led by our PDG to reach out to our clubs and to our districts more than they do, even though they have their focal points, Gombe, Ekiti, Nasarawa, where they cover. But we implore them to reach out to our clubs. We implore them to reach out more to our clubs and our districts for them to be able to carry out their advocacy in our community more than they are presently doing. I wish every one of us here fruitful deliberation. Thank you.
I'll hand the mic back to Prof.
Okay, so I'm going to call on past District Governor Adeyemi Oladokun on behalf of all the zone coordinators for RMCH in Nigeria. There are 6 zone coordinators, and it's representing all the 6 of them.
Hello, everyone. I don't want to stand on the existing protocol because they must have created crack so that it will not break. I stand to represent our zonal coordinators, David, Daniel, Elvis, Lawson, and Donatus, and myself. We are like the theater commanders for the war against all these things that we are fighting. So we take it to the grassroots. And that's because we believe that that statement by Paul Harris that says Rotary will be known only by what people see you do, what is on ground. Whatever definition you have is your own. But people want to see the achievements of Rotary. So we believe strongly in this, and we take the fight to the rural places to make sure we achieve the aim. The zones are very happy with our national coordinator, and the governments are very grateful from our zones. We will continue to support our project, our program, to make sure we succeed. Advocacy, we all know, is as old as human race. If you check the holy books, you see that all the prophets, someone came before them to announce their coming, to promote their coming, to win the consent of people. That we will do for program of scales. Thank you very much for giving us the opportunity to talk. Thank you.
I think you want to introduce him first before I give him the mic. All right. So I just got a mandate from Prof that is back to me that we are done with Rotary. Please let's welcome, on behalf of Federal Ministry of Health, the person of Dr. Samuel Oyini for a goodwill message. It's just goodwill. The way he's looking, please help me appreciate him. Thank you very much, sir.
Good morning, everyone. I want to seriously apologize that I came so late. There are so many activities. So yesterday I was discussing with the acting DFH, and we have arranged that he will be here this morning so that I can attend the other one. So I quickly went there with the thought he's here. So I'm so sorry for coming late. I want to welcome everyone on behalf of the coordinating minister, the Minister of State, the Permanent Secretary, and my Director of Family Health, who is unavoidably absent in this meeting. Thank you all. We really appreciate the Rotary for what they are doing and for all the support they have been giving for the reduction of maternal mortality in Nigeria. We seriously appreciate it. We have been working together on MPC-DSR also after the eradication of polio. And we believe with your coming into the reduction of maternal mortality space, it's also going to be a thing of the past like polio. And most especially, I also want to appreciate my mentor, my mother. He has seriously taught me so many things, and that is in the person of Dr. Salmama. Thank you so much for all this support for the pregnant women in Nigeria. For Federal Ministry of Health, we are doing a lot. And I can tell you that what we are doing is on the foundation that Dr. Salma has made for us. Carried with all the support from Rotary, with the achievement we have made so far. So what we are building on has been the foundation she has directed us to do. Thank you, Ma. We really appreciate you. It's like you shouldn't have gone the time you left, Ma. But as God will have it, that is a destiny, and we are all going to pilot it with you till you reach that point God wants you to reach. Thank you very much. So, for Federal Ministry of Health, we are doing so much, and we are going to continue to support the reduction of maternal mortality from partners, development partners, donors, private sector. We are going to do that. For Professor Lufadeju, he's my second father too. When I met him, I was thinking he is an obs and gynecologist, like somebody said. But he has done more than that. I think if God has shown you before you, I don't know if you took jam or you feel jam. If you had had that dream and God has said, no, don't feel that agriculture, maybe you will have changed your mind. But whatever it is, I think you have fulfilled that purpose. And please, let's give him a round of applause. Thank you for all the effort and support to the safe motherhood in Nigeria. We really appreciate. We'll continue to do this. Maybe by the time we continue in panel discussion, you'll hear more about what government is doing. But the support is there from Federal Ministry of Health based on what we are doing presently. In coordination, we'll be talking about that during the panel discussion. Thank you. Have a wonderful day.
Thank you. Thank you. Please clap for him for that. Thank you, and thank you. We've had a lot said. One of the striking points for me today is that we are here to make every pregnancy wanted, and every pregnancy carried to term, and every child born to survive. That's one thing that we're here to do. And then we're here to ensure that the great work that Rotary is doing is expanded, because the reward for good work is small work. So please, DGs, thank you for the work you're doing. Let's give them a round of applause. They are doing work on the ground. They are raising funding. They're expanding those funding to countries. They're increasing access. They're also putting the boots on the ground to go to the nicks and cranny. Thank you, Gombe, for that beautiful resounding result. No child has died in this hospital in the last 1 year. It shows that the intervention that we're doing is yielding results, because our health worker is holding herself accountable, is also holding herself responsible for the lives of the women that come to her. Please, can we clap for every health worker at our PACs, every woman who is standing strong. Thank you very much. We've really progressed in the work that we're doing. We have the honor to call on Toyosi Ade Bambo to take us through the purpose and rationale for this workshop. And then immediately after that, we will take pictures and have tea and network. Please make sure you make a friend. One of the things we pride ourselves in Rotary is that we make good friends. And we keep the old friends while we make the new ones. So we'll take group pictures just after the purpose and rationale of this workshop is shared. Toyosi, are we ready? Thank you.
Thank you very much. Please, a round of applause for my co-host. Toyosi had to attend to an official engagement, so I'll quickly take the workshop objectives on his behalf as quickly as possible, because we're still going to expatiate on all of these things as we go forward. The first is, of course, a lot of speakers have already alluded to some of these things, so I'll try not to dwell too much on them. First is to raise awareness, of course, on maternal and child health situation and how to ensure that no mother dies while trying to give life. So to increase the knowledge level among all of us, that's of course the participants at the workshop, about the situation analysis of RMCH, particularly the challenges, the opportunities, and policy gaps in Nigeria, as well as the findings from the Together for Healthy Families in Nigeria programs of scale implementation, having gotten halfway into the project. Another point for the objectives is to create an avenue for expert opinion. Of course, there are lots of experts who work in the MNCH space here, and of course, that would be a very good avenue for us to learn from one another and of course, get expert opinion on what has worked and how it can be scaled up to other locations. The next is to develop advocacy capacity. Of course, the workshop will seek to equip participants with competencies in designing and implementing evidence-based advocacy strategies to improve RMCH outcomes and ensure sustainability of RMCH projects. The other point will be to forge collaboration. I mean, lots of the speakers have alluded to the fact that there's strength in numbers, there's strength when we work together. I'd like to borrow a leaf from the executive director of TA Connect when she quoted the fact that if you want to go far, you need to go together. So forging collaboration. And then, of course, developing an action plan to helping participants to prepare actionable RMCH advocacy plans that reflect the local context in which they operate, focusing on policy, community mobilization, among stakeholder engagement. And then the last but not the least is to sustain the momentum of advocacy, to follow up after the workshop, to keep participants moving in their efforts as we all go forth to implement our respective projects through mentorship and further opportunities for collaboration. So of course, these objectives will keep being reiterated even as we go forward in plenary session or in breakout group sessions or whatever method of learning we are adopting per session.